Native people are proud. We are unique and we are resilient. In recent years, there's been this recurring notion that representation matters. We're starting to see more Native people in positions of influence in politics, in college and professional athletics, in Hollywood, in clinics and hospitals that we go to, and in science labs. When we see our skin tone, our culture, and our perspective at the table, we beam with pride. As it turns out, representation is also so important in research, especially in the area of clinical trials. As a reminder, clinical trials are research studies that look at whether medical treatments like medications, procedures, or surgeries are safe and helpful in treating different diseases like lung cancer. It's important to study different groups of people, different races and ethnicities, to see how well these treatments work in different groups. Native Americans are a unique people with unique genetics. And so far, research on important treatments for Native people, treatments for serious conditions like lung cancer, treatments that could be life-saving, has been limited due to the low rates of Native American participation in clinical trials. As a result, most clinical trials are on white patients, and results can't completely reflect how the treatments would work for Native Americans. Representation matters. Representation in clinical trials matters. I'm sure many Native people watch other Natives in positions of influence, and they're so proud of them, but they don't realize that they too can represent their heritage and their community as well. If you've been diagnosed with a health condition such as lung cancer, and you've been asked about participating in a clinical trial, please consider it. Please do it. Even more, if you haven't been approached, ask your doctor about clinical trials and whether there are any that you could be in. There's this overarching theme among Native people that we want to make the world a better place for our children, for our grandchildren. What better gift to future generations than possible life-saving treatments through participation in clinical trials?